Hello, and thank you for joining us. I'm Mike Spence, and this is TSPN-TV, News in Depth, and I'm here again with CEO of Sutter Amador Hospital and Platt. And we've had quite a few interviews, but over the past few weeks, there have been events throughout the community that have been very important, and you've been right there kind of at the center of all of it with Sutter Amador Hospital. And we had the Butte Fire, which was a tragic event that impacted our entire community and county and Calaveras County as well. And I go out to Mountain Ranch, and just as far as you can see, you know, the devastation. And it's been a very somber few weeks for us, and it's great to have you come on and talk a little bit about what happened out there at the hospital, because that was just a central part of you know, the center for our community. And why don't you tell us a little bit about what happens at a hospital during a crisis like the wildfire?
Okay, thanks,
Mike. Oh, and welcome to come back on.
Well, it's nice
I didn't want to hit you with a hard question. It's a very serious event.
Well, it's been a really, as everyone knows, it's been a really traumatic experience. You know, we train for these types of disasters, never thinking we'd ever see one, but we train rigorously for them. We send leaders at the hospital to federal training programs in Anniston, Alabama, where they stay for a week and simulate disaster situations. We are required, and we do conduct regular drills for disasters, and we've known for many years that the biggest risk for our community is a fire. And we certainly experienced that, as you mentioned. So during this particular event, we saw smoke. You could look right out the hospital back windows and see the smoke from the fire, which was alarming. And then the power went out, and then we activated our incident command. When we first called PG&E to find out about the extent of the power failure, we heard probably not till Saturday, which for us at the hospital was very concerning. We have emergency generator backup, but it doesn't power everything that we need. And so we knew that if it was going to extend longer than a day, we would probably have to evacuate our patients because of the heat. It was so hot, 105 degrees, I think, on 2 of the days of the fire. So we were very fortunate. PG&E, recognizing that hospitals are priority need, rerouted us by midnight that night. So we had power. We knew we could keep the air conditioning going. And then we had to deal with the evacuations of our own staff. Many of us in the Incident Command Center were evacuated as well. So it gives you a whole new perspective on how do we make sure we take care of our patients and the hospital before ourselves. That was a big challenge.
It gave everybody a fright, because you don't know the duration, you don't know how many days it's going to last, and even in a personal household situation, you know, the generator thing might be fine for a day or so, but if the fire's changing in communications. Why don't you talk a little bit about the Incident Command Center? How does that work at the hospital there you mentioned?
Well, we have a resource center that we set up. So we take one of the conference rooms and we bring out our Incident Command cart with all of the plans and directions, flashlights, radios, anything that we would need. The night before, we had gotten all the flashlights out into restrooms that needed light, and we had radio communication with our security staff. We assign roles based on federal protocols for an incident command that collate with the county and statewide roles, so that we are all using the same language about incident commanders and logistics officers and people in charge of certain functions. So we convene the incident command, we notify house-wide that we are in an incident command, which means that business is not as usual. All the leaders report, and we ask for reports on the patients, the census, the number of types of patients that we have in-house, so that we're very clear if we should have to evacuate, what coordination we would need to make with other authorities to facilitate a smooth transfer.
Well, I know Sutter Amador is an integrated organization with other hospitals. Obviously, you have a new hospital in Sacramento and all the different hospitals. Were they able to help you at all with all this? Or what do they do?
We receive tremendous support. So as soon as we activate our incident command, we call into Sutter Health, to the Sutter Health Emergency Management Corps. And there then is an emergency manager assigned as a system-wide incident commander, and they support us through the duration of our incident. So we had people that we could call and say, gosh, we need more scrubs because our staff are evacuated and they don't have access to their own scrubs. And then a shipment would arrive within a few hours. We also called because of the smoke. We had, as you know, there was terrible smoke in Jackson as the fire was moving, but still the smoke was coming in our direction. So in order to make sure everyone in the building was safe, we set up a lot of air cleaning filters throughout the building. Well, we kept needing more and more, so we kept calling for more filters, and the Sutter Emergency Management Center would arrange for them to be sent to us. So it was really reassuring that we had the support of all the other Sutter facilities to send us some staff. We had some nurses that we borrowed when our own staff couldn't be available.
Yeah, it's great to have those resources to draw upon.
It was, yeah.
You know, we think about why to support Sutter Amador Hospital. This is another reason. Being locally here in the community, you know, the smoke was not only turning toward Calaveras County and blowing up country, but we had the brush fire behind Raley's as well, and we had no idea, you know, where the fire was going to extend to, and you know what facilities would be able to provide help. I'm sure there were many people from upcountry who came down, and people from Jackson who were coming over to the hospital. What type of flow did you have activity-wise over there?
We saw more injuries, people who were being evacuated. We saw some dog bites because people were trying to corral their animals and move them to safety. We saw respiratory issues because of the smoke. And then some of the usual types of illness and injuries that we see day to day. And it was so important that we could maintain our day-to-day operations, that we could remain open for the community, for emergencies, so that people would have that security and that support at the hospital.
Yeah, I know animal evacuation was key with people scrambling. You know, I have horses, as you know. We try to, plan for these things, but no matter how much planning you do and how much you talk about it at cocktail parties, when the incident actually happens, it's, how quickly do you evacuate, especially the large animals. And I think we learned a very valuable lesson. That's number one priority, is to try to get the larger animals like horses evacuated first before anything else, because you don't always get a chance to come back in.
Yeah.
And I know a lot of people, left their homes and had no place to go, and places like the hospital and different places throughout our community, the rancheria, and a number of resources were key to people having some sort of security and knowing that they were covered.
Right. It was so distressing for everyone. We saw just tremendous community outpouring. I mean, the fairgrounds where all the livestock was able to be, the fire control center was set up there. We had great coordination locally with our public health officer, Dr. Rita Kerr, was in constant communication with us, as well as the local emergency support, the Mountain Meadow ambulance service, coordination was in constant communication with us. We were worried that we might have to evacuate our patients, so we took some precautions. We started transferring any critical care patients out of the community that were stable for transfer. We didn't want to worry that we might be in a bind and not be able to safely transport people that were on ventilators, for example. So we stopped admitting any critical care patients, and we postponed any non-emergent surgeries so that we weren't jeopardizing anyone by bringing people into the building who really didn't need to be there.
How did you stay at the hospital during the crisis? You know, the first thing I think about is to run home and check on the animals and stay, you know, at home, and work is kind of a secondary thing. But how do you manage to stay focused on the needs there at the hospital when you live so close by the fire, the impacted fire area?
Well, that's our training. I mean, that's our responsibility, is to make sure that our patients are safe first. We did have tremendous support from our managers, from our staff, everybody came together. And if someone got the call that, guess what, you're being evacuated, someone else would say, it's okay, you go and I'll take over your shift. I mean, it was phenomenal support.
Right, the employees, I mean, you have to operate 24/7, and how do you keep the employees there? You had a lot of partners to draw from and a lot of resources.
Tremendous support.
We're going to come back after the break and talk a little bit about some of the local heroes and employee stories, and you had a lot of different stories there at the hospital. We're going to ask Ann to share a few more of those with us after the break, and talk a little bit about what happens at a hospital and all the exciting things that our local heroes kind of had a big part of in our community in the last few weeks. So we'll come back after the break and talk a little bit further. Thank you.
You're watching